for now, without further ado, let me kindly invite Simon to give us a welcoming remark. Are you with us, Simon?
Thank you so much, and it's a real honor to be here at the beginning of this webinar. My name is Simon Brooker. I'm program lead for the health program at the International Livestock Research Institute in Nairobi.
Sorry, Simon, to interrupt you. We can't see you though. Have you
Yes,
opened your...
I'm unfortunately,
Okay.
I'm having problems with my computer today.
Okay, it's okay. Fine, go ahead.
So
No
sorry
problem.
about that.
It's okay.
I'm really delighted to see a really global audience. We have people from Southern Africa, West Africa, East Africa, and in fact from Europe as well. And I think this really sort of represents the spirit of the OHRECA project. It was formally implemented in 8 countries, in Ethiopia, Kenya, Uganda, Tanzania, Malawi, Burkina Faso, Mali, and Senegal. But its reach is clearly beyond those 8 countries to across Africa and globally. And the project has really been a project of partnership. It's been working very closely with national One Health platforms in each of the countries, local universities that hosted and trained the enrolled graduate fellows. VSS Germany provided important partnership. And crucially, it's engaging the communities to make sure that the work is being participatory in its approach. And we're going to hear about more of the research and the successes, but also the lessons as well. And the work has really benefited from invaluable guidance by the project's advisory committee throughout this life cycle. And I'm really glad to see some of those members here today. And I'm particularly glad to see our colleague from WOHA, Dr. Chandra Wahas, who is a member of the committee and will be joining us. And our collaboration with WOHA is really important. It's long-standing, and we're very proud here at ILRI to be designated the first collaborating centre for One Health. Throughout the webinar, we'll hear brief presentations highlighting some of the key outcomes and results. And the panelists will be able to discuss these, and I'd like to acknowledge all of their contributions. But it's not just a project that's ending this year. It's really thinking about how we can learn from the lessons and the experience to be able to advance and institutionalize One Health across Africa. And when the project started 5 years ago, One Health was very much a conceptual idea or framework. And I believe the work that you've all been involved in the OHRECA project has really helped translate this concept into new knowledge, but also practical action on the ground and policies. And I'm particularly pleased to see that we've been able to support a number of PhDs and MSCs. And really, you are the future for One Health in Africa. The work that you've done will lay a solid foundation for your careers, but I'm also confident that you'll serve as strong ambassadors for One Health as we move forward and implement some of the findings. So without any further ado, I'd like to thank everyone for organizing the webinar and for all your contributions across the 5 years. Maintaining partnerships really is hard work, and to be able to get to this point where we're all together to learn what we've achieved collectively is an important milestone. So thank you for joining, and I'm looking forward to a fruitful discussion. So back over to you.
Thank you so much, Simon. Thank you so much. This will take us to the next presentation to hear the key highlights and outcome of this project by Stephen. Stephen? Yeah, I can see you.
Thank you very much.
Thank you. Over to you. Again, if you have any question for Stephen, please put it in the QA section of the webinar. For those of you joining us late, we have English-French translation. Please click the More button and then you can see it there. Thank you. Over to you, Steve.
Great. Yes. Thank you very much. I'm really excited to be here and share some findings from an evaluation study that we conducted this year that sought to uncover some of the outcomes, the outputs and impacts of OHRECA. This process has been really useful to the OHRECA team, and we hope that this would be useful to those on the call as well who are interested in developing One Health initiatives and those who have been a part of OHRECA. We're very excited to share these findings. So about the study, about June this year, we decided that it might be an interesting time to reflect and capture some of the successes and challenges in order to inform future efforts. So the team decided on two key evaluation questions. The first being, what outcomes did OHRECA achieve and how? And secondly, what were the challenges and lessons learned? And the process involved interviewing key participants of OHRECA, which included ILRI scientists, as well as graduate fellows, but also implementation partners, collaborators, community members, and external partners that are familiar with OHRECA's work. And these interviews are guided by a framework that was found in the evaluation literature, which helped us frame the data collection and interpretation. So in this presentation, I'll just provide some key findings from this evaluation. But for more information, please note that we have a report and a manuscript that's currently being prepared that will have more information. So again, a little bit about OHRECA. Over the past 6 years, it aimed to generate new knowledge, build capacity, and identify incentives that would strengthen One Health policies, practices in Africa. And it was operationalized primarily in East African countries and also West African countries. And at its inception, it was organized under 4 thematic topic areas. And these are classic One Health issues, which include neglected zoonotic diseases, emerging infectious diseases, food safety, and antimicrobial resistance. And about halfway through the program, it was restructured to encourage working across thematic areas. And the focus now was on evidence generation, capacity building, interventions, and policy. And I mentioned this not just to provide an overview of OHRECA, but because the evaluation findings would be presented along these categories as well. For example, what did OHRECA achieve in terms of evidence generation, in terms of capacity building, and so on. So a note on outcomes here, what we mean is changes in policies and behavioral practices of knowledge users. So it's going a little bit beyond outputs, which are defined as number of articles, number of people reached. That you can be found in our annual report. So here we're very much looking at examples and stories of change, other insights that's arised from OHRECA. So now onto the findings. So speaking to the 20 different stakeholders, some of the emergent patterns, themes that emerged were that OHRECA was generating high quality science that's highly productive. So they mentioned, for example, the sheer number of papers, 67 papers, for example, providing evidence on the different thematic areas. And people also mentioned the potential for it to be used to design programs, such as raising community awareness. Some people also mentioned that there was evidence of working across disciplines, like exploring food safety and antimicrobial resistance together. And some also mentioned breaking new ground in environmental health, which is seen as a new area of work within OHRECA, within ILRI. And as one scientist described, it was a publication machine. So another theme that emerged was this idea of locally led science. So if we look at the publications, over 80% of them were first authored by a graduate fellow or a researcher based in Africa. And that has been seen as contributing to advancing careers of early career researchers. There's also higher likelihood of use of research. If we look, for example, at number of views, one of the articles reached about 14,000 views. And we can also look at altmetric scores, which measure the online attention of a research output has received. And that has been seen as a significant number as well. In terms of the topics that are published itself, There's a large focus on, for example, food safety, the blue circles just to the right, as well as One Health in general, the circles in orange, T. solium or tapeworm in yellow. There's evidence that OHRECA is building research collaborations across Africa. If you look at, for example, the affiliations of authors of the papers, starting in the center, a lot of authors based in Kenya, Ethiopia, South Africa, Tanzania, Uganda, and so on. So the outputs also extend beyond scientific papers. There's a number of presentations, reports, videos that have achieved a substantial wide range and reach as well. For example, there was a paper published in The Conversation, which is a news outlet that reached more than 55,000 views. A video on rabies reached more than 1 million views. Now moving on to capacity building, one of the main themes and one of the main topics that participants talked about were the strengthened One Health workforce, particularly among graduate fellows. So the 33 scholars that were supported in their PhD and MSCs that was seen as a substantial achievement. And talking to the fellows themselves, they mentioned gaining technical, interdisciplinary, and professional skills. And now many alumni are working in government and research institutes and applying their skills to advance One Health agendas today. And according to a collaborator, fellows are seen as beneficial, they have more publications, and in a cost-effective way as well. And what contributed to these achievements? Well, first is partnerships. For example, partnerships with Burundi University allowed for lab-based research on site, as well as access to ILRI facilities and mentorship. Another major area of capacity building of OHRECA is strengthening One Health platforms. For example, helping to inform roadmaps for implementation of One Health platform strategies. Some of the work of OHRECA also involved establishing new One Health platforms, such as in Malawi, as well as working more regionally, so going beyond national One Health platforms to regional bodies and shaping strategies at that level. So what contributed to these achievements? It's building on past investments, such as USAID work to establish One Health platforms, as well as OHRECA's role as a convener, bringing people together and bringing experiences from other contexts. And a third contribution to the capacity building theme is improving laboratory infrastructure. For example, several people talked about how during COVID, OHRECA mobilized scientists across disciplines, securing additional funding. And what this helped to do was help to create a genomics platform and lead to accreditation of ILRI's bioscience lab for human COVID testing. So it really helped support two main things, variant monitoring and national surveillance of COVID. And now the lab has been repurposed for other high threats, demonstrating the pivot potential of One Health infrastructure. And what contributed to this achievement while having existing infrastructure and ready teams in place? Here, OHRECA also made a number of contributions at the intervention level, translating knowledge into action. For example, is advancing rabies control through vaccination in Machakos County in Kenya. So the team was able to conduct a large-scale vaccination campaign, reaching 136,000 dogs and able to contribute to reducing transmission risk. Before doing this, though, they helped to understand dog population dynamics, to understand how many dogs are necessary to vaccinate in order to get a significant change, and in order to inform future targeting. And another contribution was integrating a rabies module into national reporting systems in order to increase case detection and response. So what contributed to this? Again, partnerships you will see will come up quite predominantly. as well as community engagement, so working with animal health service providers and community health promoters. So the other cases, I'm just going to mention briefly, OHRECA contributed to strengthening community-based disease surveillance, and we have more information through blogs that you can read about this, as well as improving food safety in informal meat markets in Nairobi, Kenya. So there are signs of policy influence from OHRECA's work. For example, OHRECA's work to generate risk maps informed updates to Kenya's Rift Fever Valley Contingency Plan, which will guide preparedness in response to outbreaks. And this plan was just launched last week. And many scientists of OHRECA, they sit on high-level working groups and advisory boards, and they're positioned to have future policy influence. Now to challenges and lessons. So many stakeholders mentioned challenges related to three main things. First is scope. So for example, potentially not being ambitious enough. So people talked about the need to move from, for example, from assessments to implementation, from evidence generation to the policy impact pathway. Another key challenge was related to planning and evaluation. So for example, there was a lack of a common implementation framework applicable across thematic areas. So what this means was that when the restructuring took place, to focus on evidence, capacity building interventions, there's no corresponding framework to help integrate across these themes. So that was seen as a key thing to keep in mind moving forward. There was also some challenges with team composition, where supervisors mentioned it was hard to get the time of some fellows, particularly those working within government. And on the flip side, there were some fellows that would have appreciated more time with supervisors. So more maybe having expectations agreement at the beginning would be helpful. And there were also other contextual influences that are a little bit outside the control of OHRECA at the institutional and partner level. So some lessons learned from OHRECA's experience that came from these interviews was that learning by doing, the applied research approach by graduate fellows, that works, but it requires mentorship and protected time. And secondly, partnerships are worth the investment, and they must be nurtured long-term and beyond project cycles. But looking forward, the networks that train professionals and strengthen systems that will remain and to provide a foundation to carry the work forward. And OHRECA's work also informed new projects, such as CGIR's new science program, Sustainable Animal and Aquatic Foods, of which One Health is a component of. OHRECA also led to new funding, for example, the SUSTAIN program that focuses on vaccination to prevent tapeworm. And OHRECA's work, it provides a promising model for One Health capacity building. So just want to note that this evaluation had a number of challenges, but just one quickly was that there were some trade-offs made between breadth and depth presented in this presentation, because there are many clusters of research activities. And here I try to present more of breadth. And again, for more information, please stay tuned for our report and manuscript. So in conclusion, over 6 years, OHRECA made a number of notable contributions to One Health, and learning by doing and partnerships were key to this. So I'll end it there. Thank you very much for your attention.
Thank you so much, Steve. Stephen has shared the project's key output and outcome, highlighting its goal to strengthen One Health policies and practices in Africa through the capacity building and applied research. Implemented across 8 countries in East and West Africa, this project's impact will now be discussed in more depth by our 4 panelists, each bringing unique perspectives based on their involvement in this project. So This will be a segue for us to the next session, which is a panel discussion. I would like to start by introducing my panelists before we move to the questions. Let me introduce them. I have Dr. Adjoratou Ndiaye, the Permanent Secretary of Senegal's High Council for Health and Security, a public health physician with over 20 years of experience. She has led multi-sectoral coordination on One Health, governance, and health crisis management under the Prime Minister Office since 2017. Welcome, Dr. Adjoratou, to our panel discussion. I have my second speaker, Ms. Anne Wanyaga Mwaniki, is a country director of public health in Machakos, Kenya, a community health specialist with a multiple global recognition. She champions preventive health care and community empowerment towards universal health coverage. So again, welcome, Ms. Anne. I have Maureen Kuboka as a PhD fellow at the Swedish University of Agricultural Science and a graduate fellow at the International Livestock Research Institutes. Her research focuses on food safety and risk assessment in informal markets, advancing safer food system within a One Health framework. We also have our donor representation here. We have Ms. Merle Platten, the Senior Policy Officer at the German Federal Ministry for Economic Cooperation and Development, BMZ, where she leads the ministry's work on One Health. She holds degrees in the International Relations and Human Rights from the University of Effort and Science Po, Paris. Again, welcome again. And thank you for joining us, giving us your time to take part in this panel discussion. Let me ask my Dr. Adjoratou, my first question. OHRECA has delivered a series of One Health trainings to national One Health platform in West African countries, including Senegal, Mali, Cote d'Ivoire, and Burkina Faso. Let me frame my question this way. What key lessons emerged from these trainings, and how that has knowledge been applied in Senegal, particularly in Senegal? Over to you, Dr. Adjoratou.
Merci beaucoup. Désolée pour mon caméra. Ne fonctionne pas bien. Désolée que vous ne puissiez pas me voir. Mais tout d'abord, on tenait à remercier cette invitation et de nous désigner aussi comme panélistes. Donc, par rapport à la question qui a été portée, je ne suis pas au Sénégal actuellement, je suis en voyage. Et donc, on s'excuse un peu des petits bruits. Nous sommes dans un atelier. Alors, tout ce qu'on voudrait vous dire, c'est que très tôt, le Sénégal à travers une plateforme nationale One Health, avec un leadership très élevé placé sous le leadership de Monsieur le Premier ministre, nous avons énormément participé à plusieurs ateliers dans le cadre du projet ILRI, à travers son projet One Health OHRECA, et avec beaucoup d'entités. Et le plus souvent, nous l'avons fait avec des pays voisins tels que le Mali, la Côte d'Ivoire et le Burkina Faso. Sûrement des problèmes de langue, mais ça nous a beaucoup servi à combler certaines insuffisances qu'on avait. Et la participation du Sénégal, et beaucoup de ces ateliers se sont tenus à Dakar avec des éléments qui ont mis le focus sur la gouvernance, sur la stratégie, sur la théorie du changement et la coordination du secteur. On y reviendra dans les détails. Alors, une des premières questions, de savoir quels sont les enseignements qui sont tirés. Excusez-moi, je suis en train de... Quels sont les enseignements qui sont tirés? Nous sommes à plusieurs ordres. Le premier ordre, c'est surtout sur le plan institutionnel.
Dr. Adjoratou, we lost you. There is, I think,
One minute.
Okay.
C'est bon, vous m'entendez?
Yes, we can hear you now, I think.
OK, it's OK.
Right.
Donc, je disais sur le plan institutionnel,
We lost you again.
ah oui, c'est OK. Sur le plan institutionnel et organisationnel, ça veut dire d'une manière générale, en termes de gouvernance, beaucoup d'enseignements ont été tirés à travers les différentes formations que nous avons eues avec le projet. Déjà, nous pouvons parler de l'appropriation du manuel de gouvernance One Health, qui a intégré des principes de coordination multisectorielle, de collaboration, surtout en mettant l'accent sur le fonctionnement du Haut Conseil. Ça a été sur le plan institutionnel. Nous avons aussi eu à avoir la mise à jour du cadre de gouvernance. Ceci, on entend par ça, c'est la clarification des rôles des différentes entités. Notre cadre de gouvernance est composé de plusieurs entités. Le comité de pilotage, le secrétariat permanent, les groupes thématiques multisectoriels. Donc, l'appui nous a permis aussi de réviser un peu notre cadre de gouvernance. Nous avons aussi un autre élément très fort que le projet nous a permis, la décentralisation. Nous savons qu'aujourd'hui, toutes les choses se passent au niveau décentralisé, au niveau local, donc à travers des formations et l'opérationnalisation des comités régionaux One Health, nous a permis aussi d'améliorer la communication, le plaidoyer pour une meilleure visibilité de la plateforme. Vous savez que les crises se passent au niveau régional, donc nous aussi, la décentralisation et la déconcentration nous semblent très importantes et nous avons aussi à bénéficier de cela. Nous avons aussi la continuité des formations qui nous semble très importante, comme vous le savez. Assez souvent, les prestataires des services changent, mais aussi les autorités administratives bougent. Et donc, la continuité de ces formations devient indispensable. Nous avons aussi la capitalisation et la mise en réseau des experts formés, surtout par rapport à la durabilité des acquis. Ça, si on peut le dire comme ça, c'est des perspectives qui nous semblent importantes. L'analyse du processus aussi, qui nous permet d'avoir les succès, mais aussi les échecs des initiatives dans le système de santé. Ce projet nous a permis aussi d'avoir ces aspects-là. Alors, sur le plan stratégique et opérationnel, l'appropriation d'un plan d'action intégré One Health, aligné à la stratégie sous-régionale 2025-2029. Là, actuellement, nous sommes dans un atelier sous-régional organisé par la CEDEAO à Accra. L'analyse des processus qui expliquent les succès et les échecs, l'identification des voies les plus efficaces pour obtenir les résultats souhaités, celles qui sont essentielles pour la réussite, mais aussi la connaissance du processus transdisciplinaire de co-conception, de co-construction d'une planification et d'un fonctionnement durable de l'initiative Une seule santé, avec une forte collaboration, intégration avec la science et la politique. Ça aussi, c'est un élément très, très important. Vous savez que ILRI fait beaucoup de recherches, énormément de recherches, mais ce qui est fondamental, c'est le lien entre les résultats de la science et le niveau politique, parce que c'est le politique aussi qui prend des décisions. Ça aussi, ça a été un élément très fort à travers ce projet, mais aussi l'intégration de la théorie du changement qui nous permet, au niveau du programme, de pouvoir mieux asseoir un peu la stratégie de la sécurité sanitaire. Sur le plan technique et opérationnel, on a l'appropriation de l'outil NEOH pour évaluer la maturité et la fonctionnalité de la coordination. Ça a été un élément très important qui nous a permis, comme on l'a dit tantôt, à réviser un peu la gouvernance, la capitalisation des bonnes pratiques issues de certains projets au niveau communautaire nous semble très important. Quelqu'un l'a dit, le niveau communautaire est un champ d'action très, très complet pour la mise en œuvre de l'approche One Health, tels que des projets Tchellal et d'autres projets, mais aussi l'appropriation de la théorie du changement, comme on a dit. Alors voilà un peu, on a aussi la même question, quelles sont les applications concrètes au Sénégal? C'est le renforcement de la gouvernance et de la coordination, c'est le développement d'une théorie de changement, c'est les tenues régulières de la coordination multisectorielle à tous les niveaux, selon le cadre institutionnel, la formation des comités déconcentrés et décentralisés dans plusieurs régions, telles que la région de Kédougou, Vélingara, Kaffrine, Sédhiou, la mise en place d'un système de gestion des données One Health. Depuis 3 jours, on est en train de discuter de ça au niveau de la CEDEAO, le développement et la mise en œuvre d'outils stratégiques, la validation, l'élaboration, la finalisation et la validation du plan national de sécurité centrale One Health. Ce que je dois vous dire au Sénégal, notre plan stratégique, c'est le plan national stratégique multisectoriel selon une approche One Health. Nous avons combiné les deux en sachant que l'objectif de cette stratégie, c'est carrément renforcer la sécurité sanitaire selon une approche One Health. L'appropriation communautaire et décentralisation, ça c'est tellement important, avec plusieurs expériences qui ont été menées à travers le projet Tchellel, les formations communautaires avec les clubs d'Imitra, les champs écologiques. Donc ça aussi, c'est des activités que nous avons menées au niveau communautaire, mais aussi nous n'avons pas oublié la sensibilisation sur l'usage des pesticides et de la rame, aussi bien au niveau stratégique qu'au niveau opérationnel. Nous avons aussi la collaboration et le plaidoyer avec une participation active aux initiatives régionales et de l'Union africaine. Tantôt, j'étais en train de vous dire que nous sommes actuellement à Accra pour discuter un peu des initiatives régionales, surtout sur le partage des données, mais aussi la contribution à la réflexion sur le financement durable des plateformes. Là aussi, c'est un défi majeur. Hier, on faisait un plaidoyer pour partager dans la sous-région comment mobiliser des financements pérennes, des financements étatiques. Il faudra que la sécurité sanitaire selon une approche One Health soit intégrée dans les cadres référentiels des différents pays. En tout cas, au Sénégal, on a débuté avec une ligne budgétaire qui a été établie carrément pour la sécurité sanitaire selon une approche One Health. Ceci est un élément très, très important pour le financement pérenne. Voilà un peu, on partagera dans les discussions les résultats et les impacts observés, le renforcement du leadership du Sénégal.
I'm sorry, wrap up for us. Go ahead. Wrap up for us. Thank you.
Thank you.
Finish what you started. It's just to flag out the timing.
On clôture pour la première question. Merci beaucoup.
Merci beaucoup. Thank you so much. Thank you. Let me bring Ms. Anne for my next question. Over the course of the project, the team worked closely with One Health unit in the Machaco County to implement a rabies vaccination campaign. The project delivered about 600 doses, almost reached 106 households, along with the other supporting activities. What measures did you take at the start to support the effective project implementation, and what milestone and gaps emerged in building One Health partnership at the county level? Over to you, Ms. Anne.
Thank you very much, and thank you for having me. So during the implementation of this project, we at the county, some of the measures that we put in place was to have the county One Health coordination platform. And here we were having joint meetings between the two departments, mainly the Department of Health and the Department of Vet. And the main thing was to ensure that we are moving in one direction. As Vet is doing the dog vaccination, we are also working with them closely. And we were using the local data to guide our vaccination schedules from the vet side. They were having microplans, how do they move? But most important is that we had 80 healthcare workers, inclusive of CHPs, that were trained on this project and what will be expected of them. And throughout were involved in this project. And on top of that, throughout the period, the project was in Machakos County. About 307 CHPs also were sensitized across the years on the importance of this project and also cascading this information. The rabies how to farmers to ensure that, or dog owners to ensure that they have their dogs are taken for vaccination, and this vaccination was being provided for free. And really, dog owners came out to have their dogs vaccinated. Reaching across the 9 sub-counties, we were able to do about 60 wards, 60% of the 40 wards, and about 100,000 households were reached in the impact of the dog vaccination. The community health promoters in working with their community health assistants also lot of advocacy meetings across the wards they work in to ensure that the community understands and is able to support the dog vaccination. Most importantly, to share the message of the importance of having a responsible dog ownership and ensuring that their dogs are vaccinated. And then another thing we were doing is that any dog or that we had samples of suspected rabid samples, we were sharing them with the vet department. So the main thing here being ensuring that there was the planning aspect from the two departments, the training of the community health promoters and the healthcare workers that were keen implementing the project and the sensitization that was happening there. And then the community engagement, constantly engaging the community on what was happening. And all of that, some of the achievements, even as we came to towards this and having discussions with the team that was implementing this, the County One Health Committee coming up strongly and having discussions between the two departments again, aligning our rabies elimination plan with the national strategy so that we ensure by 2030 we are having zero death by caused by rabies. And then the implementation of the integrated bite case management and the surveillance they are coming. And then another thing that we did was community engagement, that one strongly coming in. And from the project which came out strongly was some of the key messages that were developed in both English, Swahili, and also in Kamba to ensure that this information is cascaded not only by the vet department, but also by our health promotion department, so that that message reaches the community and the dog owners. So we also had a lot of engagements with our executive in regards to what was happening. I remember when the team was visiting Machakos, we also had a talk and a meeting with the team at the higher levels. This is because at the end of it all, for sustainability, we will need financing to ensure this continues way after the project. And these messages are shared, and this definitely will be pegged on the financing that has been there. So I think that is what I would wish to say. Thank you.
Thank you so much, Ms. Ann. What has been done there was quite impressive and interesting, especially the local language translation and reaching all the communities were impressive. Thank you so much. One of the legacy of this project is creating a new generation to take the One Health initiative forward. And I think with this project, about 33 graduate fellow has been created through PhD and MSc programs. I think Maureen is one of the product of this capacity building generation. So Maureen, let me bring you for the next question. As one of the OHRECA graduate fellow, you had an opportunity to engage in the mentorship program that's extended beyond your core graduate research. I would like you to share your experience with us, especially, are there any aspect of OHRECA program that you feel were not fully addressed but should be strengthened to better support future graduate fellows? Do you want to take this? Maureen, thank you. Over to you.
Yeah, thank you, Sihai. I would address 3 levels of mentorship that we received during the program. The first one being top-down, and this is when we were paired by, the fellows were paired with scientists, 1 or 2 in the fields of interest. And from there, then they guide you and hold your hand from developing the objectives of the project all the way to having the outputs, generating the outputs, and even beyond the outputs to creating impact through knowledge and innovations. So that was the first one. For example, I was paired with Professor Delia Grace and Dr. Florence Mutua, and we have been working across East Africa, advancing food safety. So my work was basically in Kenya and also in Burundi. And that is culminating with a number of outputs being journal papers. But beyond that, we have also seen impact in terms of knowledge created, because we were working among meat sellers in Nairobi and also some parts of Burundi. The next one is peer-to-peer, or maybe we can say horizontal kind of mentorship. And this is where we had mentorship between us, or amongst ourselves as the fellows. And this was instituted, or it was in plan from the inception of the project. And this helped us to receive criticism amongst one another. It helped us to sharpen one another. I can give one example of where we had lessons. We had different programs to share our work and how our work is progressing bi-weekly. And that helped us to develop our projects and also to advance our work. So that was headed by Christina Rosell in the beginning, and then later on it was taken over by Nicholas Ngwili and also Dishon Muloi. And then we honed many skills, and one of them was scientific communication, and also just developing ourselves as scientists. The third one I would talk about is the OHRECA. OHRECA is a center being stationed at ILRI. And ILRI is a knowledge hub, I can say, because we have diverse expertise and also access to facilities and resources, scientific resources of every kind. And so basically, you definitely would not go wrong having top-down mentorship, peer-to-peer mentorship, and having people all around you at ILRI holding your hand as a young scientist or early career researcher. Maybe what can be improved moving forward, maybe having research with the end in mind. So just beyond thesis, producing thesis and journal papers, we can have fellows understanding that it is important to go beyond journal papers and thesis and producing outputs to producing impacts and also innovation. So I think maybe that would be very important moving forward. Thank you.
Thank you so much, Maureen. Thank you for highlighting the peer-to-peer influence, bottom-up, top-down coaching and mentoring from our leader scientists. We're highly appreciated by you guys, and then even the one you emphasized at the last, you finished with research, having research in mind than thinking of generating thesis. Thank you so much. This will take us to our next speaker. I'm going to invite Merle Platten from BMZ. Merle, we'll start by appreciating you. We really greatly appreciate the financial support from BMZ providing for this project. And then now I'll project my question to you. BMZ has funded many development programs in Africa and beyond. Could you briefly share BMZ's focus on One Health and how it is aligned with OHRECA's work?
Of course. Thank you very, very much. And first of all, thank you all for the invitation to participate in this webinar and also the opportunity to learn from all of your experiences. As you mentioned, BMZ, so the Federal Ministry for Economic Cooperation and Development of Germany, has a long-standing commitment to promoting the One Health approach, be it project-based in development cooperation or through our support to the quadripartite and global health initiatives such as the Pandemic Fund. To us, One Health is key when it comes to pandemic prevention and also to addressing major health risks such as zoonotic diseases, NTDs, and AMR, which is inter alia why Germany has, for instance, committed 169 million euros to the Pandemic Fund, underscoring our dedication to addressing the root causes of pandemics. And here, the Pandemic Fund explicitly integrates the One Health approach as a core objective. And many of the projects supported by the fund focus on strengthening disease surveillance systems, improving laboratory capacities, and building skilled health workforce at the human-animal environment interface. Moreover, we, over the last 3 years, have inter alia supported the quadripartite, and I see that Chadia is in our call today, so she might also be able to speak to that. But we've supported the quadripartite in the development and the ongoing implementation of the One Health Joint Plan of Action and its implementation guide. And I think it's fair to say that the quadripartite, together with OLAP, has been instrumental in advancing the One Health agenda on a global level and has provided a robust foundation for addressing zoonotic diseases, AMR, and pandemic prevention. But as Simon Brooker, I hope I pronounce your name correctly, has pointed out, One Health only works when the concepts are translated into practice and policy. And this is where the countries and communities come in, as they need to identify how One Health can help address relevant challenges they face and to take action accordingly. But action must be informed, and of course, national and subnational institutions as well as communities must be equipped capacity-wise to implement those actions. And this is precisely where OHRECA comes in. And I mean, like, we've heard so many examples over the last couple of minutes how OHRECA has contributed to capacity building and informed policies based on research. Just as an example that has also already been touched upon is the trainings like the ones recently conducted with stakeholders from West Africa, which have empowered communities, or in this case, One Health platforms, to develop their own visions, strategies, and tangible One Health outcomes, and also the communication campaigns based on scientific evidence, like the sensitization campaign on rabies co-designed by local communities, have been stellar examples of how OHRECA has contributed to putting One Health into practice. So this is how it aligns with our BMZ involvement in general. And this is also why we're more than happy to hear that One Health will also be inter alia continued in the context of CGIAR's Sustainable Animal and Aquatic Foods Program. So at this point, also congratulations to the entire OHRECA team, including, of course, the graduate fellows and PhDs who've done a tremendous job. So thank you all. And we're glad to have been able to contribute.
You're muted, say.
Oh, sorry, sorry, I was muted. Thank you so much, Marley. We really appreciate your contribution on this project. I'm challenged a little bit with timing, so let me pick one question for Maureen. Maureen, let me bring you back, Maureen. So you carried out your food safety research with a strong One Health background, again from the project capacity building and mentoring session. How did this additional knowledge influence the design, conceptualization, and reporting of your research? And what recommendation would you offer to students undertaking similar projects?
Oh, wow. Thank you. Thank you again.
1 minute. I will challenge you in 1
Right.
minute to save the time. Okay, go ahead.
Yeah. Maybe it's good to start by saying that I came from a food science background, and so I'm not a vet. And so the concept of One Health was new to me. So the inception, the mentoring sessions, and also the capacity building sessions provided a platform for me to be able to understand the concept of One Health. And after understanding the concept of One Health, then we moved to the application. In application, I think I can just give 2 examples because of time. One is we learned the importance of having communities as part of our research. And so in my research, then I had to incorporate like a social science kind of aspect where we went to communities and we had discussion with communities regarding food safety, foodborne hazards, and also moving forward, because we are dealing with informal markets, how they would like to see informal markets serving the communities. So that was one. And secondly, it was also about using the partnerships that had been created from the inception of the project. So I did my work in Burundi, as I had mentioned earlier. And so we leveraged on the partnership that had been created with the University of Burundi, with the vet labs in Burundi, to be able to bring the project to a success. So collaboration and also communities are part of the things we learned, and then I was able to apply them. Yes, I think it would be good for any other fellows coming after us to have this from the inception of the project and not later on, maybe during outputs or just activities, but having it from the moment you're designing the objectives and the project. Thank you.
Thank you so much. This takes us back to your earlier comment, have the end result from the beginning. Yes, thank you so much. And Maureen, let me bring back Miss Anne and challenge you with 1 minute to respond to the question I'm going to ask you. Looking at OHRECA supported project and other donor funded initiative, what key lessons have emerged and what action has the county adopted or plans to adopt to ensure sustainability of rabies control?
Thank you for that. And indeed, that was one of the best and project in terms of eye-opening on the aspect of One Health. I would just put it in maybe pillars and say that we, as a county, we have and we must ensure that we have sustained mass dog vaccination for us to get to the over 70% coverage. Again, ensure that there is integrated surveillance and dog bite case management. Obviously, ensuring the reliability of access to post-exposure prophylaxis and especially from our department, the Department of Health. Now that we already have healthcare workers that have been trained, and we are grateful that the project was able to do that and community health promoters sensitized. Then in terms of sustainability as a county is to look at how we can use the ones that are trained to cascade more information, the ones that are not yet trained, and most importantly, use the ones that have been trained and sensitized to ensure that in those areas that they have been trained, the communities understand responsible dog ownership and continuously engage the community on rabies prevention, and even above that, the One Health approach. Importantly also is the formation of the One Health committee and the meetings that will continue way after the project is done, so that even after this, we continue to speak as one committee on the future of One Health and engaging at different fora and different conversation to ensure that we are advancing that conversation. We cannot talk anything and forget financing. So the big thing there is to have the county rabies elimination budget line. I mean, have a conversation about how these two departments will work together, but how will they be financed so that we are able to ensure dogs are vaccinated, we ensure the community is made aware, but also we are ensuring that the post-exposure prophylaxis is being provided and timely. Luckily and currently, I know we have enough vaccine that are being distributed across all the sub-counties, which is a good thing, and this is a post-exposure prophylaxis for that matter. But most important is to ensure this continues. It is available in an event anybody gets a bite or a scratch. Strengthen the surveillance system again, as we do the routine surveillance of any other disease we are also doing, and which we have continuously done. But I think in the discussion in one of the committee meetings that we had is also to share our data from the Department of Health and the Department of Vet and also Environment, who we work closely with, the data that we are getting from our clients and from our systems, having conversation with these key departments so that we can see how then we can use data to make decisions that are going to impact the people of Machakos. is something we have already done and we continue doing, is to ensure that we continue having community engagements and community education, to using our health promotion team, our community health promoters, and our community health assistants. That is happening. That does not require so much. Like I said, we already have the materials to share, and also from the support of the national government, we also have other materials. So that will continue to happen. Thank you.
Thank you so much. I think educating and continuing engagement with the community, the way forward to sustain this. Thank you so much for highlighting that, of course, including the other activities as well. I think I'm a little bit challenged with time, so let me finalize this panel with merely with you. Let me bring you back for this question. We know you are keen on ensuring project outputs are shared widely so their benefits can be scaled up. Which outputs do you find more relevant for your program, and what networks or partnership would you suggest for effective dissemination? Merle?
All right, thank you very much. I'll try to be as short as possible. But first of all, let me start by saying I think that OHRECA is already doing a very good job in terms of disseminating your outputs and key learnings, be it using the applied research for capacity building, working with WOA and FAO, and publishing various reports, but also this webinar series. So you're already on a great track here. From my point of view, what is needed is that we need some evidence for the One Health approach. That is, we need to illustrate how and prove that One Health helps in addressing and mitigating major health risks. And it's important to share learnings from One Health implementation. And from BMZ perspective, in this regard, GIZ, for instance, our implementing entity can function as a knowledge broker, so it can connect actors, building on existing structures and networks, and expanding them in the future as well. What might also be fruitful might be also connecting and feeding your learnings into the quadripartite networks like the community of practice, but also regional institutions like ECOWAS and the like. And then there are, of course, also other networks like Women for One Health Network, but also in Germany, we can learn from OHRECA's experiences. And this could, for instance, happen via exchanges with German research institutes and platforms such as the One Health platform of Germany, which is also a One Health research platform in our country. So those are just some exchange formats that come to mind. Thanks again.
Thank you so much, Marley. I think please join me to thank all my panelists for their great insights and sharing their experience and lesson with us. Thank you so much. I clap from my end to you all. Thank you. This will take us to the next session. I'm going to invite, we have been implementing this project in different 8 countries. Of course, we brought our partners to hear from them in this panel discussion. Still, we can hear some voices from these different countries. For this, I'm going to invite Bernard Red, he's our senior scientist at ILRI, and also leads the One Health Center in Africa. His research focuses on neglected and emerging infectious diseases and improved disease control tools for both public and animal health in developing countries. So Bernard, let me invite you for the next session, please.
Thanks a lot, Sihai. Thanks a lot for the panelists. Thanks for the participants for staying with us until now. I'll actually take a very few minutes because the specific role that I want to do is really to thank everybody who has participated with us in the project. And what comes to mind, really, there are 5 main categories of those participants. Of course, the first one being BMZ. We are very grateful for the support that you gave for the last 5 years. Usually projects last a short while, but this sustained support for 5 years really demonstrates your interest in supporting these activities. The second group, of course, I want to recognize really the OHRECA team. We had very good researchers, very good dynamic group of people, including Leanne Thomas, Ashley Moodley, Delia Grace, Nicholas Ngwili, Dishon Muloy, and many others who really, over time, we really had very nice discussions, new ideas on how to formulate things, how to adapt to new realities. And as it was said from the beginning, we started when we were working from home, and when we came back to the office, we needed to adjust and move on. So a big thank you to all the project team members. The graduate fellows, I don't want to say much more. It has been clarified by Maureen, but really they were our agents on the ground. They really did all these activities, sometimes on their own, but many times with us. And most of the publications which were mentioned earlier on were really covered by the graduate fellows. The next is the advisory committee members. And really, and I see Jadia Wanos is one of our advisory committee members, and she'll be coming later on to speak here. But, and also Dita Schillinger. So we really got lots and lots of advice from the advisory committee members who are really following us and discussing with us how to improve on delivery. And we really couldn't have done any better without you. And we'll be having a short while to discuss that much more. And lastly, all the partners, all the partners from the private sector, the public sector, including VSF Germany, who was our implementation partner in Machakos. Other projects which we implemented at the same time, including Build Uganda, COHISA, as well as AfroHun, which was doing, the trainings. All this, we were able to learn from each other, pick up new ideas and new leads. So all those people have recognized. We really thank you a lot for working with us. I invited two people, mainly partners. One of them is a partner, and of course, another one is Dita, to also give reflections, but also help me in thanking the rest of the team members. So let me start with Dr. Canisius, who is from Burundi. He's the Director for Agriculture, Livestock, and Extension Services. He was one of our key project partner in Burundi. I think for in this case, Canisius, what really would like you to help is on behalf of all the partners, take a minute to also help share thanks with all the other people who are here. So Canisius, you are there? I had seen Philad. Anyway, let's then proceed with Dita. Dita, you can come in and then give your remarks as we wait for Canisius to prepare to do the same. So I think you are coming in on behalf of the advisory committee members and help us to thank everybody who participated in the project. I thought I had also seen Dita.
I see Dieter in the call. He's unmuted now.
Can you hear me?
Yes, we can hear
Yes,
you,
we
Dieter.
can hear you.
Okay. Yeah, it's a real pleasure for me to be here. And we mark the culmination of the BNZ-funded OHRECA project today. And some history things, because it's partly an anniversary. Early in 2019, it all started with some visits Christina Rösel and I had in Berlin, in Germany. And we were successful in convincing the ministry to establish a One Health Center in Africa. And then Björn Neary, who was our major partner at this time in BMZ, came to Nairobi and was also visiting our Kapiti Research and Wildlife Conservancy. And he was very, very fascinated by what we are doing. And so later on, Björn, Christina, and I were able to convince the state minister in BMZ, which was Maria Flaxbart, and she was a veterinarian, understood immediately the concept of One Health. And she came in November 2019 to Nairobi and I had the pleasure to sign with her exactly yesterday for 6 years. It was the 11th of November 2019, the OHRECA contract. So that was a very interesting approach, and unfortunately, Björn is not anymore in the BMZ, and Maria Flaxbart left politics at all. Otherwise, I think they would be very happy to hear what we actually are doing. And keep in mind, BMZ was also funding Build Uganda and helped us a lot financially to support Kenya, Uganda, and Ethiopia with diagnostic support during the pandemic situation. Just to make it short, I want to express my sincere gratitude to everyone on the team for the incredible work on the OHRECA project. Your dedication, expertise, and collaborative spirit were truly exceptional and the key factors in achieving OHRECA's goals. Thank you for your hard work and commitment. And I would also like to thank the advisory committee member. I was a member as well from April 2023, after I left my position as the DDG of ILRI, and had a very good working relationship with all the people on the advisory committee. But I also would like not to forget to say thank you to Jimmy Smith, who was the DDG, was the Director General in the first 3 years, who really was supporting all these activities very much. Thank you very much.
Thanks a lot, Dieter. When I was mentioning my team members, I forgot to include Florence Mutua. Sorry for that, Florence. So, of course, you're part of the team. Do we have Canisius? Or maybe the network is a challenge?
I don't think it's.
Yeah, all right. Okay, so I don't have much more, just also to emphasize that, we here, we have really benefited a lot from all your partnerships. So I want to hand over back to Sehai.
Thank you so much, Bernard. This will take us to the next one. I think we invited few people to share their experience, but this is also a moment for everybody to say something about in this webinar. So next we are going to project Menti. I would like all of you to open, if you're on laptop, your laptop, if you are on phone, your phone, and just type menti.com. And then you can give this code in the chat. If you can see that Jeffrey posted a code in the chat, I can read it for you. If you're already on Menti, please type menti.com and then write this code. 32099965. It's in the chat. You can see that. In the meantime, Jeffrey, can you project the Menti on the screen for us, please? I see Joseph raised his hand. Is it for comment? Can you put it in the chat? We can see it. Please answer the question until Jeffrey presents the result on the screen. We are going to challenge you with this question. The question is like, if you had to describe the future of One Health in just one word, what would be that word? It is not a sentence. We didn't ask 2 words or a sentence. It's just one word. Already start coming up. As you can see on the screen, collaboration is now taking the space. It's just one word. What will be the one? Oh, yes. Collaboration, promising, progressive, county funding. That's one word. We ask it for one word, not 2 words. Challenge yourself with one word. Progressive, hopeful, important, meaningful, but collaboration. Oh, now collaboration, progressive, and promising is competing each other. It's a swapping. Progressive is coming now on top. Okay. Keep pressing on the answers. Progressive, promising. collaboration. Okay, data. Still, these three are popping up. We give you 1 more minute. Those of us chatting, writing on the chat, please put it on Menti, multi-sectoral. I see it on the chat. Collaborative, inevitable, promising. These three are competing. Thank you. Keep on pressing your answer. It seems it's essential came up now. Essential, promising, inevitable. Okay. Now this tree is taking a space of collaboration. Okay, let's see which one is sustaining at the end. Wholesome, okay. Wholesome came up now. Thank you. It seems like the result is consistent. Let's give it 10 seconds and we go to the second question, Jeff. The second one is so funny. If time allows, after all this rich discussion, if One Health were a person, how old would they be? Still learning to walk in the rebellious teenager years, finally responsible adult. Okay, okay. Finally, a responsible adult seems like taking the space. Okay, now. Oh, teenage is taking a Keep on pressing your answers. Interesting. In the rebellious teenage years. Good. 3.1. Thank you so much. Thank you so much. And I think this will take us to the last session, and then I will invite Dr. Chadia for us. From what you have heard from the discussion, from the panel, the presentation, please conclude the webinar for us. Thank you. Over to you.
Thank you so much for inviting us. It was a great pleasure to be on the advisory committee, but also to be hearing the discussion, the presentation that we had today. I would like to take this opportunity to just share a few closing reflections on the journey of purpose that OHRECA has done and the achievements and future opportunities. So we learned through this webinar that OHRECA was created to strengthen the human, animal, and environment health through research, capacity building, policy translation, and One Health networks. And on the span of 6 years of the project, this vision was really realized through the work on emerging infectious disease, zoonotic, food safety, antimicrobial resistance, and much more. What we heard from you today, that the key impacts of this project, that we were able to strengthen networks across Africa. We have done a lot of capacity development, training, and also education in terms of PhDs and master degree students, mentorships, coaching. Importantly, OHRECA research has informed guidelines, development frameworks, and practical interventions in the region. So it was very relevant to the region to tailor the solutions depending on the African ecosystem and communities. So for the lessons learned from this project, it was very clear that context matters and flexibility matters. We need adaptive approach to help navigate the emerging challenges and to take into account the local reality to shape our success. We also learned from this project that integration is essential. We need to collaborate across the sectors, but this needs time and needs effort from all participating agencies. We also learned that to move from research to impact, we need to translate the evidence to policymakers and to the communities and to the practitioners. So from all these lessons learned, looking ahead, we see that now we have to shift into the phase of sustaining and scaling this impact that the project has managed to do. And to do this, we need to continue working with our national partners to embed the One Health approach into their national and regional systems, to formalize those One Health platforms that was created or strengthened under OHRECA, and also the communities of practice and the networks, and to leverage more the evidence in our policies, curriculums, and outreach. And of course, to continue to support the next generation of scientists and practitioners, as we have seen from the presentation from Maureen. To do this, of course, we need to mobilize resources and partnerships to ensure long-term continuity. And we are very thankful to BMZ for enabling this work and also enabling the work of the quadripartite and the One Health high-level expert panel. And we would like to see this going also into the future and for long term. So to finish, I would like to thank ILRI leaderships and the OHRECA team for their commitment, their dedications, the high quality product and the high quality partnership that they managed to achieve. And I would like to thank our partners across Africa for their leadership and engagement. And of course, we not forget the field teams, the practitioners in the countries, and all the contributors who have made this achievement possible. So in closing, I say that this is not an end. This is just the beginning. And these achievements that we had under OHRECA are substantial. We know that there are challenges, but there are also opportunities. So let us here commit to translating those lessons into action to sustain the One Health mindset. And I am glad that you talked about being an adult now as describing One Health. And also we need to ensure that One Health contribute to building our healthier, more resilient Africa together. Thank you so much again, and I look forward to the next phase of our collaboration. Thank you, Sue.
Thank you so much. I think you conclude the meeting for us. This takes us to the closing of this webinar, and I would like to thank everybody online who is attending, listening to us. Thank you so much. We really appreciate your stay with us. Thank you.